Seroquel is one of the most commonly prescribed antipsychotics, with over 13 million scripts being written for it each year. So today, we're going to review it so that you can be better informed when deciding whether or not to start this medication. By the end of this video, you're going to know how the medication works, what it's used to treat, commonly used dosing strategies, and its top side effects. So make sure to stick around. And shout out to Amanda for this video request. So the first thing to know is that this medication goes by two different names. Seroquel is the brand name and Quetiapine is the generic name. And then the other thing to know is that it's also considered to be an antipsychotic, specifically an atypical or second generation antipsychotic. So it's in the same class as medications such as Abilify or risperidone. Now, what does Seroquel treat? It's FDA approved for the treatment of schizophrenia in adults and children 13 and older. It's one of the rare medications that hits all three phases of bipolar disorder. So it can treat mixed or manic episodes, it can be used as maintenance treatment, or it could be helpful in bipolar depression. With the mixed and manic episodes in particular, it's approved for kids 10 and older, and then it's also approved as an adjunct treatment for major depression. This medication has a wide range of off-label uses, and these include insomnia, anxiety disorders, behavioral issues, and impulse control disorders. So how does Seroquel work? Seroquel is thought to mainly affect the neurotransmitters serotonin and dopamine, and these changes can lead to the reduction of positive or negative symptoms of schizophrenia. It can also help with mood stabilization or improvements in things such as aggression or agitation. Now, how is Seroquel dosed? Seroquel is usually taken 2 to 3 times per day, but something to know is that there's also an extended release version, and this only has to be taken once per day. Now, the dosing with this medication is pretty variable depending on what it's being used to treat. So for example, low doses of around 25 to 150 milligrams often hit the histamine receptor, and this leads to its sedative properties. Doses of around 150 to 300 milligrams often affect the serotonergic or the noradrenergic neurotransmitters, and this has more antidepressant effects. And then only at doses of 300 milligrams or higher do we see dopamine receptors being affected, and this is why the average dose in schizophrenia is around 500 milligrams per day. In practice, I've seen doses as small as 12.5 milligrams daily to doses as high as 800 milligrams daily. So you can see how the dose range for this medication is pretty huge. But what to know is that the max recommended dose in adults is 800 milligrams per day, whereas in kids under 9 years old, it's 400 milligrams per day. And the key takeaway is that you want to work with your doctor on figuring out the lowest effective dose that'll work best for you in particular. And remember, it might take a few weeks before this medication starts working, so don't lose hope if after a few weeks of being on it, you don't notice any positive benefit. And now the next big question, what are the side effects of Seroquel? The top 5 reported in adults taking Seroquel for the treatment of schizophrenia and bipolar mania include headaches, agitation, somnolence, dizziness, and dry mouth. In kids who are taking it for bipolar mania, the top 5 reported were somnolence, dizziness, nausea, fatigue, and increased appetite. Now I want to break down some other side effects that I'm commonly asked about. The first is weight gain. When looking at clinical studies, both kids and adults who took this medication for schizophrenia had over a 20% chance of having a weight gain of over 7% of body weight. The second side effect that I want you to know about are blood pressure fluctuations. What we see in kids is an increase in blood pressure, whereas in adults, we actually see a decrease. When evaluating pediatric studies, 15% had a systolic elevation of greater than 20, and 40% had a diastolic elevation of greater than 10. Systolic being that top number and diastolic being that bottom one. In adults, what we typically see is that patients will go from a lying or seated position to a standing one, and then they'll become lightheaded or dizzy, and this can increase the risk of falls. This is called orthostatic hypotension, and it's seen in approximately 4 to 7% of adults taking this medication. The third thing to know about are extrapyramidal symptoms. Seroquel, compared to other atypical antipsychotics, is considered to be in the lower risk group for these symptoms, and this is a major factor that makes this medication more appealing than some of the other ones. Now, something else to know is that Seroquel has 2 black box warnings. The first states that elderly patients with dementia-related psychosis treated with antipsychotic drugs are at an increased risk of death. Studies show that those who are taking atypical antipsychotics are 1.6 to 1.7 times the risk of death than patients who were treated with placebo, and these were often secondary to cardiovascular or infectious reasons. The second black box warning is for the potential of Seroquel to increase the risk of suicidal thoughts and behaviors in those aged 24 and younger. Therefore, all patients should be observed closer for worsening of symptoms, unusual changes in behaviors, and suicidality, and this is particularly true when starting the medication or when making dose changes. And then something unique about this medication, and a sort of interesting fact, is that when it was first being developed and studied, they found that it caused cataracts in beagle dogs. Human studies have not shown an association, but interestingly, if you look at the drug label, it still recommends a slit lamp examination every 6 months. So when someone is put on Seroquel, it's ultimately unknown exactly how long they'll need to be on it, because it's dependent on the condition being treated. Someone with schizophrenia might need to take this medication for years, right? While someone who is taking for aggressive behaviors or insomnia might only need to be on it for a few months until behavioral therapy starts to work. Regardless, when deciding to come off of Seroquel, please do not stop taking this medication without talking to your physician first, because they can help work with you to come up with a plan on how to stop the medication so that unwanted symptoms don't occur. Some people will experience involuntary movements called withdrawal dyskinesias within the first few weeks of lowering the dose or stopping the medication. These typically go away, but I've seen them persist for a couple of months in some patients following discontinuation of treatment. Now, click that top video if you want to learn more about risperidone, which is another commonly prescribed atypical antipsychotic.